Hi everyone, my name is Gregory Mark. I'd like to post the case on discussion board. We discussed when do we actually prescribe the deprogrammer for the patient, what indications and contraindications. So I'm not able probably to discuss the whole case within this 5 minutes, but I'm going to give you some clinical points. Probably you can take this to your clinic. So the most important, of course, is to check dental history of the patient, medical history, and to see what the patient has been complaining about. So in this particular case, patient came, and you can see he filled out the forms, and what it says in the past 5 years, have your teeth been changed, became shorter, thinner, or worn, or has your bite been changed? So it means that patient's existing MIP, maximum decuspation, doesn't work. So if we're going to do any kind of full rehabilitation, we have to change the bite. We can't rely on MIP. And that's why it's very important for us to take a good questionnaires from the patients and also lead to the right answers. What it means also sometimes patient been but the answering in the wrong way, so we have to explain him what the question means. So in this particular patient, he wants to change his front teeth, make them better. He wants to change the bite, do some cosmetic work. So it requires to work. Is it going to be MIP position, or it's going to be CR position for his restorative stage? As again, as a clinician, I have to question is it actually true or not. And you can see that he also have a trouble biting the bite. Okay, this type of questionnaire is right here. It's related to MIP. This question right here on top: do you feel like your lower jaw is being pushed back when you try to bite your back teeth together? It means also that the bite is not also stable, and we have to see with the position for the lower jaw. So this is going to lead also us to give the patients a deprogrammer or some kind of appliance to make sure we can see the position of the CR and also MIP. The most important when we prescribe this deprogrammer, the patient has to know the instructions, okay, what they have to follow. In this particular case, again, I gave him the deprogrammer. You can see it's separating back teeth. The most important also, the separation in posterity is supposed to be 1.5 millimeters, not more. If you get it more, the patient is going to be in a translation mode, not a rotational mode in TMJ. And that's why we have to make sure so that the blade of deprogrammer is adjusted properly and patient bites directly at 90 degrees to the blade, to make sure there is no sliding movement when the patient bites. It has to bite only in a certain point. So we usually prescribe this appliance for 7 days. But patient can be deprogrammed in 20 minutes, patient can be deprogrammed in 2 days, in 1 day. It's not exactly, it has to be 7 days, but most patients by the 7 days, usually they reacted within 7 days in a positive way. When the posterity separates, it usually relaxes the muscles and try to put the joint into the socket, into the CR position. The patient has to come back to you when it's when he bites a repeatable spot at the front, and also there is no tension in the muscles and the joint. Okay, and the patient feels comfortable. As you can see, that's a position the patient has. Okay, when he bites on that blade. Okay, and that's what it says before deprogrammer, but actually it's after deprogrammer. The patient been complaining on tooth number 14 that he always been having sensitivity. So since wearing the deprogrammer, he felt that the sensitivity completely gone. You can see even in clinical pictures that the distal line, distal angle of this ridge, okay, is completely been worn. and that's what's premature contact the patient had when he used the MIP. So the body has to adjust, either it's breaking the teeth, front teeth, adaptation. So what the price are the adaptations for this particular patient. That's why we articulated the case, and after the patient come back, and let me show you this back again. So when the patient come back to you and biting on the same spot, you put a bite registration material on the posterior teeth and you articulate if you're using conventional method. But you can also scan this patient, and then execute any software you've been using. You can articulate this case, and then you can put a differentiation between MIP and ECR position. So in this particular case, as I said, this is after deprogramming. This is his voice deprogrammer, right? And you see it's at the spot where he bites constantly, repeatedly. And this is what he had before the deprogramming. You can see that's about the initial contact. If you're putting just a regular articulating paper, and you will see that dots, blue dots all over the place, and you'll never even figure out it's this is interference point that patient has. That's why he complains about number 14 sensitivity. If I'm going to put just to get close to the clinical picture right here on a model, you can see how the broader contact on the distal area number 14. So this is comparison images. You can see before and after. So this is on your left side. If you look at the screen, it's after, and this is before on your right side. And you can see the difference, how much shift the patient has, okay, according to after deprogramming. In this particular case, his lower jaw moved back again. Okay, you can see that it creates space, so there is no interference, and that going to give you guidance if you're going to restore, increase the OVD. So make sure this is a position you're going to take as your reference point. You're going to restore and establish the same position on your final restorations. Okay, because if restoring over here, you might probably, if you're using your MIP as a restorative position, that sensitivity or discomfort still will continue. It might affect your final restoration, especially if you're doing veneers or any kind of aesthetic work at the front teeth. So besides, of course, the question has also been asking, can we increase the bite with the voice deprogrammer or any deprogrammer? Yes. If you established, let me go back again. If you established that position, CR position, you can add the composite here because it's a rotational axis anyway, or you can subtract. Let's say if you want to decrease this OVD, but all depends on your treatment plan, and your treatment plan will be based on a facially generated treatment plan. Okay, as you can see over here. So this is the model was transferred to the jig, okay, to transfer the facial upper jaw reference to the jaw, to the face, I'm sorry. And this is what actually the breakdown, how we usually determine the position of the teeth, the way we can add, okay, the position of the lip, the widths, heights. So everything was again putting all the points together. So make sure that we deliver the right treatment plan, and we can tell the technicians which teeth we're going to work, which teeth we have to increase the length, the width. So this is combinations of putting together. It's not just placing the deprogrammer making decision for us. The deprogrammer is giving us a reference point. Okay, if we have to find any CR position, any shifts, any doubt of the patient's occlusion. So hopefully this video probably help you in giving just the beginning of the stage. If you have any questions about the deprogrammer, but again, you can always email me on markgregorydds@yahoo.com, or put the comments on YouTube videos. Thank you guys.